interest of time. Uh, Thank you for joining us today. I want to welcome you to the California Department of Public Health Childhood Lead Poisoning Prevention Branch's Lead Week webinar series. My name is Bethan Lamb, and I am a health educator with our Community Outreach and Education Unit. Before we get started, the presentation today, I'm going to go over some of the webinar settings and features. The audience will be muted to give our speaker an uninterrupted presentation. The Q&A button on the bottom of the screen allows you to type questions for our presenter. If you don't see a Q&A button, you may type your questions into the chat. Questions will be answered at the end of the presentation. Captions are available by clicking on the button labeled CC at the bottom left corner of the window. If you don't see the CC button, you can go to the More button on the top of your screen and enable captions. Please note that this webinar will be recorded, and the recording will be available on the CDPH YouTube channel next month. This year, our Lead Week series is focused on lead in consumer items and common goods such as food, spices, toys, cosmetics, and remedies. In addition to our presentation today, you're invited to join us for one more presentation this week. Tomorrow, we will host the Consumer Product and Safety Commission. You can visit our Lead Week webpage for the times of each presentation and to register for the remaining session. For today's presentation, our guest speaker is Eileen Apt. Eileen is a chemist with the Plant Product Branch within the Office of Food Safety, Center for Food Safety, and Applied Nutrition of the U.S. Food and Drug Administration, where she is engaged on scientific and policy issues relating to chemical contaminants. She also serves as a senior technical expert for the U.S. delegation to the Codex Committee on Contaminants in Food. Prior to coming to the FDA, Eileen was a senior program officer for the National Research Council's Board on Environmental Studies and Toxicology, where she directed toxicology, exposure, and risk-related studies. Eileen received her master's and doctoral degrees from the Harvard School of Public Health. At the end of the presentation, Eileen will be available for questions, and a recording of this presentation will be available on our website, which is listed on the slide currently on the screen. A link to our website will also be posted in the chat. Thank you so much. And with that, Eileen, I'm going to hand it off to you.
Thank you, Betham, for the introduction, and I'm happy to be here this afternoon to share information on FDA initiatives to reduce lead in foods. I just wanted to comment that when I sent Betham the introduction, we had not gone through a reorg. And we have since. I'm now with the Office of Food, Chemical Safety, Dietary Supplements, and Innovation in the FDA's Human Food Program. And I just want to note, although I am presenting today, the work I'm discussing is a result of contributions from many FDA staff in our Human Foods Program, and I just want to acknowledge their contributions to this work. So when I was asked to speak, I was given these following topics and questions to address, which include an overview of efforts by FDA to decrease lead in consumable products and remedies, a process for identification of lead in consumable products and the response. What is FDA's response when an item is identified to contain lead? That includes by a state agency versus consumer groups. How FDA works with state and local agencies to respond to these situations. Do they form collaborations with local agencies? And what should families do if they are concerned? Best practices.
Eileen, do you mind sharing your slides?
Oh, I'm sorry. I apologize. I thought I was sharing them. Okay. Do you want me to start over or just go from where I am?
You can just go from where you are. Yeah.
I apologize. I thought it was from current slide. Okay. So as way of background, this is our agenda now. I'm going to provide background, FDA efforts to reduce lead in foods, including identifying lead in foods and FDA response, working with stakeholders, including stakeholder engagement and collaboration, and consumer messaging. So as way of background, lead has many different sources. It may be found naturally in the environment, but there's a much larger contribution from industrial sources, such as mining or electroplating. Food processing can contribute to lead in foods from, for example, use of lead-containing equipment, such as piping and lead-soldered machinery when food is manufactured. Lead contamination of crops also occurs through, for example, atmospheric deposition of lead on leaves and soil where crops are grown, and the crops then uptake the lead from the soil. And also through use of water contaminated lead that may be used for irrigation. There have been historical reductions in lead over time since the 1900s. And this is a result of a myriad of efforts, including ending the use of leaded gasoline, in the US specifically banning lead solder in food cans, lead paint removal, ending use of lead-based pesticides, and regulations or guidance on lead levels in drinking water and foods. So all these efforts have contributed to dramatic decreases in lead levels in foods. This is a figure showing these reductions, and it presents the average daily dietary exposure to lead for children 1 to 3 years of age. On the y-axis is the daily dietary exposure in micrograms. Across the x-axis are years spanning from 1980 to 2016. So you see lead concentrations in the dietary exposure to these children 1 to 3 years old has decreased from 43 micrograms per day to 1 microgram, which is a 97% decrease. This is a similar graph, but showing more detailed data broken down by age group. So this data is from our total diet study, which is a long-term exposure assessment study that we conduct to look at trends in exposure over time from exposure to contaminants and nutrients, which I'll talk a bit about more later. But this graph shows on the y-axis, the lead exposure in micrograms per day. Again, on the x-axis, we have the period of time, the years from 1980, but this one spans all the way to 2020. And although there's different total diet studies presented across the years, you can see the decrease in lead concentrations in the bars and across time. And you'll see that the bars, the studies looked at different age ranges for children, but you still see that decrease over time all the way to 2020. Finally, I want to show one other graph from our total diet study, which shows food group contributions to lead exposure in children 1 to 6 years of age. The y-axis, the vertical bar, shows the food groups, and NEC is not elsewhere classified. Along the x-axis, it's a percent contribution to dietary lead exposure. And the reason I think it's very important to see this graph is it illustrates exposure. And exposure is a function of both the lead level, or the concentration of lead in a food or foods, multiplied by consumption, the amount a particular person or population eats. So, for instance, on this graph, you see the longest bar, or the greatest dietary exposure contribution from lead is to grains and baking products. But the important thing to note is lead levels in these grains and baking products are relatively low. They're quite low, but this age group, 1 to 6 years, consumes a lot of the product, resulting in a higher percent contribution to dietary lead exposure. So although lead levels in our diet have decreased over time, there's more we can do. And FDA is working on that. And one of the initiatives, the first one I'll talk about, is our Closer to Zero initiative, which is an iterative, science-based approach to reduce lead levels of toxic elements, including lead in foods commonly consumed by babies and young children over time, and to as low as possible, while maintaining access to nutritious foods. Closer to Zero initiative focuses on 4 toxic elements. I mentioned lead, but also arsenic, cadmium, and mercury, due to their relative toxicity, their prevalence in the food supply, and relative contribution of food as a source of exposure. In this initiative, we also prioritized babies and young children because of the impact exposure to toxic elements, including lead, can have on their development. And we have prioritized foods commonly consumed by babies and young children because of this population's small body size and metabolism make them more vulnerable to the effects of these contaminants. This is our Closer to Zero cycle of continual improvement. For each contaminant, for example, we evaluate the science, we propose draft action levels, we consult with stakeholders, and we finalize these action levels. FDA evaluates scientific evidence by collecting data through monitoring programs, examining the levels of lead or other toxic elements in the food from this data collection, evaluating the data, understanding exposures, and establishing health-based reference levels. We then propose draft action levels for specific foods and categories of foods. After we issue draft action levels, we propose those action levels and get input from stakeholders in the consult step. For example, on the achievability and feasibility for making reductions to the levels of the contaminants in the foods. We then adjust the draft action levels based on the current science for managing the contaminant and issue a final action level, which helps to articulate to industry FDA's current thinking and provides a level for industry to strive to achieve. This is our landing page for the Closer to Zero initiative that presents our activities related to the program, including research and monitoring and compliance. And if you scroll down to the bottom of the page, you'll find our publications, public meetings, and a wealth of resources, and we update the site as more information becomes available. So to inform the Closer to Zero initiative, as well as other FDA efforts for reducing lead and other toxic elements in foods, FDA routinely monitors contaminants in the foods. FDA collects data for understanding how much lead or other contaminants is in the food. And it is important to note that these data are collected for various purposes, including signal detection, as well as compliance activities. The Toxic Elements in Food and Foodware Compliance Program is a targeted monitoring program that monitors levels of lead and other toxic elements in foods and foodware. Food selected for analysis includes those that are suspected of having elevated levels of toxic elements based on historical data or other information available to us, with particular emphasis on foods consumed by babies and young children. We augment these data with special surveys to collect and analyze toxic elements in foods of interest. For example, as shown here on this publication in Food Additives and Contaminants, this is a publication on a survey of toxic elements in foods for babies and young children. In addition, FDA has a cooperative agreement with the states called the Laboratory Flexible Funding Model, or LFFM, that enhances capacity and capability of state human and animal feed testing laboratories. I will talk more about the LFFM cooperative agreement later in the talk. In addition, as I alluded to before in the graphs I showed, FDA's Total Diet Study is another monitoring program that assesses levels of contaminants and nutrients in a representative sample of the U.S. food supply. It's a long-term survey to collect and analyze foods commonly consumed to understand trends in exposure to contaminants and nutrients. So this would include lead. And this slide is just to illustrate that through the Total Diet Study, we collect both regional samples in 6 regions of the country during 2 seasons across a period of 2 years, and we also do national collections as well. As I mentioned, for informing our action levels, FDA develops health-based reference values or toxicological reference values to evaluate whether exposure to a certain level of lead or other contaminant in a food may be a health concern. And this publication here illustrates that in 2022, FDA updated its health-based reference value for lead, or as it's called, the interim reference level, or IRL, to reflect the updated Centers for Disease Control and Prevention's blood lead reference value, on which FDA's interim reference level is based. FDA's interim reference level is a measure of exposure to lead from food that the FDA may use to determine if the amount of exposure to lead across foods could result in a specific health impact. So as I mentioned, we use our information from FDA's monitoring for lead in foods, the agency's interim reference level for lead, as well as other information, including exposure, to establish action levels for certain foods. And these action levels are published in guidance to industry, and though not binding, These action levels are intended to encourage manufacturers to maintain lead levels in foods below the action levels, thus reducing risks associated with dietary exposures. And as I illustrate here, FDA has established through a guidance draft action levels for lead in juices. And you can see here on the slide with a 10 parts per billion action level for lead in apple juice and a draft action level of 20 parts per billion of lead in fruit and vegetable juices other than apple. And this includes juice blends that contain apple juice. The lower action level for apple juice is based on the fact that apple juice is the most commonly consumed juice by young children in the US. FDA has also established a draft action level for leads in foods intended for babies and young children in this guidance. And here I show we've established 3 draft action levels in this guidance. 10 parts per billion for fruits, vegetables, excluding single ingredient root vegetables, mixtures, yogurts, custards, puddings, and single ingredient meats. And a draft action level of 20 parts per billion for single ingredient root vegetables and 20 parts per billion for dry infant cereals. So action levels give industry clarity about the levels of contaminants in a food at which the FDA may regard the food as adulterated. But FDA does not need an action level to take action when the level of a contaminant, such as lead, in a food may make the food unsafe. FDA takes action on a case-by-case basis in determining whether food that contains a contaminant, such as lead, is adulterated, considering the level of the contaminant found in the food, the type of food, consumption data available for that food, and the most currently available toxicological information. And companies still have the responsibility to take steps to ensure that the products they manufacture are not contaminated with unsafe levels of contaminants in accordance with the Federal Food, Drug, and Cosmetic Act and FDA's regulations. Under our current good manufacturing practice, hazard analysis, and risk-based preventive controls for human foods rule, provisions require certain manufacturers to establish and to take preventative steps to significantly minimize or prevent chemical hazards, such as those from arsenic, cadmium, lead, or mercury, that may require a control. In October 2023, FDA recalled cinnamon, apple puree, and applesauce products from the market. The FDA, state, federal, and international partners and industry worked to mitigate the risk and remove the products from the market after North Carolina health officials identified the connection between children with elevated blood lead levels and consumption of the apple puree and applesauce products. Through FDA's processes of incident response and investigation, and in conjunction with regulatory partners and industry, FDA's leading hypothesis is that the contamination event was the result of economically motivated adulteration of the cinnamon used in the applesauce and apple puree products. Following this October 2023 recall of cinnamon apple puree and applesauce products, FDA initiated a targeted survey of ground cinnamon products from discount retail stores and analyzed samples for lead. FDA determined that certain ground cinnamon products contained elevated lead levels, and prolonged exposure to these products may be unsafe. The FDA advised consumers to throw away and not to buy these ground cinnamon products. The FDA recommended that the firms voluntarily recall these products. This is a table showing the 3 public health alerts issued on March 6, 2024, July 25th, 2024, and July 30th, 2024. And these are all from our on our website with the link below. And the table here shows the number of brands affected by the public health alert, range of concentrations in parts per million that were found in these products, as well as the number of samples identified. So FDA is continuing additional follow-up from its initial analysis of these cinnamon products and issuance of public health alerts. FDA is continuing to test for lead in cinnamon and other spices, including through the Laboratory Flexible Funding Model Cooperative Agreement with the states. FDA is continuing oversight of foreign firms and imported foods, including through increased and more targeted import screening. The distributor of the cinnamon used in the contaminated applesauce products has been put on import alert. And in August 2024, FDA issued a warning letter to Austro Foods, the manufacturer of the cinnamon used in these applesauce and apple puree products, citing them for violations of the current good manufacturing practice, hazard analysis, and risk-based preventive controls for human food rule. So, in addition to FDA's work in the US, FDA is also an active member of the Codex Committee on Contaminants in Foods, or CCCF, which is an international standard-setting organization that is committed to food safety and fair trade. And CCCF establishes maximum levels for contaminants in foods, as well as develops codes of practice for reducing or preventing contamination of foods. So FDA, as head of the US delegation to CCCF, has led updates to date to update maximum levels for lead in multiple foods. And in 2022, we led an effort and worked on a publication on a code of practice for the prevention and reduction of lead contamination in foods. And this code of practice, which incorporates input from stakeholders, member countries, and a literature review, addresses lead reduction in various sectors, including agriculture, drinking water, food ingredients and processing, production and use of packaging and stored products, and as well as consumer practices, excuse me. Oops. FDA also works extensively with stakeholders. Stakeholder engagement is done in a myriad of ways, including through public meetings, which we post and announce on our website. One recent meeting was that I showed the link here for was for the development of improving a process for FDA's assessment of chemicals in food post-market. At this public meeting, FDA presented their positions, and then they got feedback from stakeholders, and the recording is available on our website if there's interest in that. We also hold frequent meetings with Consumer Coalition and industry groups. We solicit input through public docket. For example, here is a link to the Federal Register notice announcing the action levels for lead in food intended for babies and young children, the draft guidance for industry, where we received public comment, and the comment then would inform the final guidance. And we also share information on our website through constituent updates. So for example, here is a link on a constituent update announcing the draft guidance for industry on these action levels for lead in baby foods. FDA collaborates with state agencies to test foods for lead and other contaminants and share this information. For example, as I've mentioned, the LFFM cooperative agreement between FDA and state partners enhances the capacity and capabilities of state human and animal food testing laboratories. The increased sampling that comes through the LFF program improves for food surveillance, data gathering, and can be used to remove adulterated product from the market. As I understand, there are 55 state programs currently enrolled in LFFM, and 14 states have 2 or more agencies with LFFM cooperative agreements, and one of these is California. Under the LFFM cooperative agreement, states share their testing results with FDA. FDA reviews results to determine whether follow-up by FDA is appropriate. Other samples are deferred to states for follow-up. States also share results or seek FDA evaluation outside the LFFM program. And FDA collaborates also with other federal agencies on lead contamination, such as with the U.S. Environmental Protection Agency, the U.S. Department of Agriculture, and the Centers for Disease Control and Prevention. FDA provides information to consumers in various ways, including making information available on our website. The information conveyed to consumers is often informed by social science research that FDA conducts, and I will discuss more about this in subsequent slides. So this is an example of FDA's consumer messaging surrounding the ground lead in cinnamon, the ground cinnamon and lead, the lead in ground cinnamon products that I mentioned previously. And on this webpage, there would also be a listing of the cinnamon products that were put on public health alert. And the recommendations to consumers include advising them to stop using or dispose of the products, to not eat, sell, or serve ground cinnamon products listed on the site, that these products have a long shelf life and consumers should check their homes and discard the products. And probably most importantly is that if there is a suspicion that someone has been exposed to elevated lead levels, is to talk to your healthcare provider. And on this site, there's also a link to industry and consumer assistance. And this is where the that page, I'm sorry, it keeps advancing. The site goes to this page for industry and consumer assistance, and there are additional buttons that you can click with general inquiries. You can report a complaint, and each complaint is filed and responded to. There's also a button for frequently requested information, which includes links that are commonly asked about, information. And then there's a button to stay connected, to sign up for emails, or to be connected to other social media outlets through FDA. As I mentioned, FDA consumer messaging is informed by research. FDA conducts social science research, including focus groups, in-depth interviews, and surveys to study consumer behavior around food to inform our public health messaging. For the Closer to Zero initiative, which are the examples of consumer messaging that I will show you, our target audience are parents and caregivers, as well as healthcare and educational professionals that serve these populations. This research is important in developing and disseminating messages to encourage healthy food choices amidst the complicated nuance that foods that are part of a healthy diet can also be a source of lead or other toxic elements. And examples, as you see on the slide here, of study objectives from this research are really to learn about existing knowledge that people may have, to examine reactions to potential communication strategies we may be thinking about within the agency, and to learn about questions that the target audience has and what information and resources might be most helpful. The need to ensure accurate messaging is really exemplified in this figure from the Dietary Guidelines for America, our U.S. nutrition policy, and required by law to be implemented in any federal food, nutrition, and health program. The figure shows dietary intake compared to recommendations in the dietary guidelines for food groups and subgroups. The bars above the center line, which are purple, represent the percent of the population meeting recommendations, and the dark bars underneath this line show how most of the population are not meeting the recommendations. So one purpose of the FDA nutrition advice is to support families to move intakes of children to better align with the dietary guideline recommendations. Research has informed our messaging to parents and caregivers to protect against the effects of heavy metals. And here you see on the slide two distinct messages. The message one being to focus on variety. So a variety of foods helps ensure that children get essential nutrients for development. Eating a variety of foods decreases the likelihood of exposure to lead or other toxic elements. And the second message is nutrition adequacy. So many nutrients help protect against the effects of heavy metals. For example, iron and zinc are essential nutrients for child development and can decrease the absorption of lead or other toxic elements. As I mentioned, and we discussed previously, FDA has issued guidance on lead in juices, as well as on arsenic in juices. So along with the issuance of this guidance, we shared messaging through our website on juice consumption for babies and young children, titled What You Can Do to Limit Exposure to Arsenic and Lead from Juices. This juice example demonstrates where following the dietary guidelines for Americans recommendations on juice can reduce exposure to toxic elements, including lead. The messaging states that always encourage a variety of healthy foods is key, and juices should be limited. Infants should not consume any juice, and children ages 1 year and older should focus on whole fruits over juice. When juice is consumed, it should be 100% juice or 100% juice diluted with water. Yeah, sorry, keeps advancing. Here is another example of consumer messaging on our website. Healthy food choices for your baby aged 6 to 12 months. The web page shows our consumer studies research put into practice. For healthy food choices for your baby aged 6 to 12 months, the recommendation is to focus on key messages of variety and on foods that are rich in iron and zinc, noting also that many nutrients help protect against the effects of contaminants in foods. And with that, I conclude my presentation and thank you for your attention. And I guess we open it up for questions.